Good afternoon, Mr. Mayers. I'm Hillary. I'm a nurse practitioner student. What brings you in today?
Just a checkup.
Alright, is there anything that's concerning you?
No.
Family significant medical history?
Mm-mm.
Family history?
No.
Any allergies to any drugs, food, or latex?
No.
Okay. First off, we're going to just start testing some of your neurological functioning. Can you tell me your name and date of birth?
Zach Mayers, September 26, 1991.
Good. And where are you right now?
Examination room.
What time was your appointment?
6 o'clock.
Okay. What year is it?
It's 2016.
Good. Can you tell me what they mean by the squeaky wheel gets the grease?
The person that complains the most gets helped first.
Okay. And can you count backwards from 7?
7, 6, 5, 4, 3, 2, 1.
Good. Now we're going to move on to the examination of your skin. Have you had any concerns with your skin? Any abnormal lesions that you're concerned with, or moles that are new?
No.
Okay. So I'm also just going to assess the skin temperature, the color, quality, the texture of your skin for any excessive dryness or moisture, your skin turgor. I'm also going to be looking for any edema, which I don't see any. Skin temperature on your legs feels good. I'm also looking at the hair distribution, the texture, the color, and the quality. Have you noticed any changes in your hair?
No.
Good. Have you noticed any changes in your nails?
No.
Okay. So I'm just inspecting the nail configuration and the shape of your nail. I don't see any signs of clubbing. Alright, everything looks good on your skin. I do notice just a couple scars, but that's about it. Now we're going to move on to examining your head. I'm first just going to start by looking at the shape of your head, the contour, the positioning, and the alignment on your body. Okay. I'm going to look at your scalp for any lesions. Have you had any lesions or moles show up on your head that you're concerned with?
No.
Now I'm just going to look at your facial symmetry and the alignment of your features. Good. Palpate your skull. I'm just looking for any masses or lumps. Any headaches or head trauma?
No.
Okay. Any sinus congestion?
Mm-mm.
Okay. Frontal sinus, maxillary sinus. Good. Temporal arteries. And your temporomandibular joint. Can you clench your teeth for me? Good. Now open and close your mouth. Good. And move it side to side. Good. Any pain there?
No.
Alright. I'm just going to take a listen to your arteries. Now we're going to test a couple of your cranial nerves and your sensation on your face. First thing I want you to do is smile for me, frown, puff your cheeks, good, and wrinkle your forehead. Good. Now I want you to close your eyes and let me know when you feel this cotton wisp on your face.
Mm-hmm. Yes. 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 Yes.
Go ahead and open. Now I'm going to be looking at your eyes. First off, going to look at the alignment, the symmetry, the spacing. Good. Be looking at your sclera and your conjunctiva and your lacrimal ducts. Close your eyes for me. I'm looking at your upper and lower eyelids. I don't see any redness or swelling or discharge. Next, going to palpate your external structures of your eye and your orbit, your eyeball and your lacrimal ducts and apparatus. Do you wear contacts or glasses?
No.
Okay. Now what I want you to do is to read the bottom line for me. First I want you to cover your right eye, then your left, and then both eyes.
4, 2, 8, 7, 3, 9. 4, 2, 8, 7, 3, 9. 4, 2, 8, 7, 3, 9.
Now I'm going to look at your pupils and then we'll test your peripheral vision. I want you to let me know when you see my fingers come back into your vision.
Mhm. Uh-huh. Yes.
Now I want you to focus your eyes on my finger and follow it. Now I want you to focus on an object behind me and then move your eyes to this. One more time to the good. I'm going to move on to your otoscopic exam. To dim the lights. First going to look at your right eye with my right eye. I'm going to start at about 15 degrees, looking for your red reflex. Good. I'm just looking at your optic disc and following your arteries and veins. Good. Everything looks good. See your optic disc and your physiological cup. No papilledema or hemorrhages. Everything looks good. Now we're going to move on to the assessment of your ear. Any ear pain, discharge, difficulty with your hearing.
No.
Then once again, begin looking at the alignment, positioning, and palpate for mobility, tenderness. Okay. Now we're going to assess some of your hearing. I want you to repeat what I say.
Apple. Baseball.
Okay. Next thing we're going to do is the Weaver test. Let me know which side you hear the sound on.
Both.
Okay. Now we're going to do the Renee test. Let me know if you can hear the sound and when it goes away. Can you still hear it? And let me know when it goes away. Can you hear the sound? Let me know when it goes away.
Okay.
Can you still hear it?
Okay.
Did it go away?
Yep.
Okay. Now we're going to look at your otoscopic exam. I want you to lean your head over to the right. Lean it over. Just going to be looking for your tympanic membrane for any bulging or redness, which I don't see. It's a pearly gray. I'm going to do the other side now. Lean your head over to the left. Okay, let me just change funnels. Alright, now we're going to look at your nose. Any congestion, runny noses, anything like that?
No.
I'm just going to assess symmetry, positioning. I'm going to be looking at your septum and your nares. Okay. Would you lean your head back for me? Good. Looking at your septum, your turbinates, for any abnormal crusting or polyps or discharge. Good. Now we're going to assess nasal patency. Have you had any trouble smelling? Okay. Now I want you to do is close your eyes and I want you to let me know what you smell.
Alcohol. Alcohol.
Good. Now we're going to move on to your lips and your mouth. I'm just going to once again look at your lips for any crusting, cracking, or dryness. Okay. Now open your mouth. Let me see your teeth. Good. Just kind of looking at your condition of your teeth, your buccal mucosa, your gingiva. Good. Open wide for me and just relax your tongue. Good. I'm going to look in your internal, your mucous membranes, your hard and soft palate. Good. Now wide. Looking at your tonsillar fossa and your uvula. Okay. Swallow for me. Good. Swallow one more time. Good. Now say ah.
Ah.
Good. Now protrude your tongue and move it side to side. Good. I've also been assessing your voice quality as you've been speaking to me. I haven't noticed any hoarseness or slurring.
Okay.
Okay. So everything looks good with your mouth. Now we're going to move on to your neck. Any neck pain, neck stiffness, or tenderness?
Mm-mm.
Okay. So I'm just going to inspect once again for the shape, the alignment, for any masses, skin lesions, abnormal skin folds, or webbing. I'm going to palpate your lymph nodes. These are the pre-auricular, post-auricular, tonsillar, submandibular, submental, turn your head to the left, anterior cervical, posterior cervical, supraclavicular, anterior cervical, posterior cervical, supraclavicular, and your occipital. Also looking at your trachea and the alignment, it looks like it's centered. There's no deviation. Swallow for me. Good. Just going to palpate your thyroid. I'm going to feel for the lobes. Palpate it from behind. Swallow for me. Good. Any heat intolerance, cold intolerance,
No.
extreme weight loss, or weight gain?
Nope.
Okay. Now we're going to look at the range of motion in your neck. So what I want you to do is to look up at the ceiling. Okay, look down at your chest. Look to the right. Now to the left. Okay, and bend over to the right. Bend over to the left. Good. Shrug your shoulders. Good. Right. Now I want you to turn. We're going to look at your posterior thorax and do some of your cervical spine. I'm once again just going to look and inspect. I'm looking at your AP diameter, which is your anterior posterior diameter. We don't want that too barrel chested. Yours looks pretty proportional. I'm looking for any lesions, if you're using any of your accessory muscles to breathe, which you're not. I don't see any retractions. You're breathing at a really good and regular rate. I'm next going to just palpate your ribs and your paravertebral muscles. Any muscle spasms or muscle pain?
No.
Alright. Any neck pain? Any thoracic spine any pain in this area right here.
Uh-uh.
Okay. This is your lumbar spine. Good. Now I want you to say 99. This is your tactile fremitus.
99, 99, 99, 99, 99, 99, 99, 99.
And this is thoracic expansion. It just shows me how well your lungs are expanding and if it's symmetrical. Deep breath in and out. Good. I'm going to percuss. Should hear sounds of resonance. Now we're going to do your diaphragmatic excursion. I want you to take a deep breath in. Okay. Now breathe out and take a deep exhale in, or inhale in and exhale completely. Good. Now the other side. Take a big inhale in. Now exhale, and inhale and exhale. Good. Now we're going to move on to auscultation. Just take a deep breath in when you feel my stethoscope on your back. Good. Now I want you to whisper 99. Okay, and say E.
E, 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 E.
Have you had any kidney pain?
No.
Okay. This is just assessing for costovertebral angle tenderness. I don't see any. Now we're going to move on to your upper extremity musculoskeletal assessment. I'm going to begin by palpating your shoulder joint. Have you been experiencing any shoulder pain or tenderness?
No.
Okay. I don't see any swelling or redness over your joint. Good. Now I want you to just turn this way for me. This shoulder, any pain or tenderness?
Mm-mm.
Good. Okay, so turn this way. We're going to do some range of motion. I want you to lift your arms forward and up over your head. Okay, now push them back. Okay, now I want you to go out to the sides and over your head. Good. And bring them across your body. Okay. I want you to take one hand and try to reach the opposite shoulder blade. Place your hands at 90 and then rotate them up. Good. Any pain there?
Mm-mm.
Okay. Now I'm going to do your elbow. And your wrist and your fingers. Any pain in these joints?
Mm-mm.
Now I want you to flex and extend your elbows. Okay. Now pronate and supinate your hands. Okay. make a fist. Open your hands wide. Good. Now I want you to place them like this and move them inward and outward, down and up. Good. And spread your fingers and bring them back in. Good. Now move your fingers down and up. Okay, good. Now we're going to assess the strength of your joints. So what I want you to do is to place your arms forward like you're emptying a Coke can and try to press up against it. Good. Now place your arms at 90 and push out. Good. Now place them as like you're in a T and slowly lower one at a time. Good. Now I want you to flex your elbows like this and pull, try to push up against me and push down against me. Good. Now just turn them over and now push up against me with your wrists. Good. And down. Good. Squeeze my fingers. Spread your fingers open. Try to push against me with your fingers. Good. Now I want you to push down against me as I try to pull up on your thumb. Good. Alright, so now we're going to move on to cardiovascular assessment. I'm going to just assess your chest for any heaves or lifts that I can visibly see. And I'm going to palpate for any thrills or lifts or heaves that I can feel. I don't see any. I'm just going to listen to your chest. Your heart, there's 5 different places. The first is the aortic valve, pulmonic, Erb's point, tricuspid valve, and the mitral. Now listen with my bell. Okay, now I'm going to, once again, I'm going to listen to your lungs on your anterior thorax side. I'm going to just inspect your rhythm for any retractions or accessory muscles, which I don't see. I'm going to test for tactile fremitus. Just say 99.
99, 99, 99, 99, 99, 99.
And palpate your ribs. Any tenderness over any ribs? Okay. Good. I'm going to percuss. And listen. When you feel my stethoscope, take a deep breath in. Good. Now say E.
E, 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 E.
And whisper 99. 99. Everything looks good with your lungs. Now I'm going to have you go ahead and lie down. I'm going to lift your head of the bed for you. And once again, I'm just going to inspect your chest for any heaves or thrills while you're heaves or lifts while you're lying down at 30 degrees. I want you to turn your head to the left. I'm just going to look for any JVD. I don't see any. I'm going to palpate your carotid arteries. Bilaterally and one at a time. I'm going to take a listen to them with my bell. Have you take a deep breath in and hold. bruise. I'm going to just palpate your chest again and feel for your point of maximal impulse. Good. And I'm going to listen once again to your heart sounds. Now I want you to turn over on your left side. Now I want you to go ahead and lie on your back. I'm going to lower your head and we're going to move on to your abdominal assessment. Okay. Any abdominal pain, nausea, vomiting, change in bowel habits?
No.
Okay. So first off, I'm just going to start by, once again, inspecting, looking at for any scarring, masses, or lumps. I'm going to look at your umbilicus for any cyanosis, redness, irritation. I'm going to assess for a hernia. I want you to lift your head up for me. Good, I don't see any. Alright. Now I'm going to move on to auscultation. I'm going to listen to all 4 quadrants. Now I'm going to assess for a friction rib over your liver. Take a deep breath for me. And breathe out. And now over your spleen, deep breath. And out. Now I'm going to listen to the major arteries in your belly. The first is the renals. Listening for any bruise. Your iliac arteries. Your aorta. Your femoral arteries. Good. I don't hear any bruise and you have really active bowel sounds. Now we're going to move on to percussion. I'm just listening for tympani and areas of dullness, bladder, gastric bubble. Now we're going to assess your liver span. So what I want you to do is take a deep breath in for me. Okay. Good. And now your spleen. I'm going to palpate with light palpation first. Any bladder tenderness?
Mm-mm.
Palpate for your liver. Deep breath. Good. And now your spleen. Good. And your aorta. I'm going to move on to your peripheral vascular system and the remainder of your neurological and musculoskeletal. I'm first going to just palpate your epitrochlear lymph nodes, which are in your upper arm, your brachial artery, your radial artery, capillary refill, epitrochlear lymph nodes, brachial artery, radial, capillary refill, your femoral arteries, but nice and strong. Now I'm going to move on to your hips. Any hip pain, tenderness,
No.
your iliac spine, anterior iliac crest, greater trochanter. Any knee pain,
No.
tenderness, okay? Any swelling or joint stiffness
No.
in your ankles, in your toes, any pain in your feet.
No.
Also looking for any edema. I'm looking at the skin distribution, the hair distribution on your skin color. I don't notice any excessive redness, tenderness. Any tenderness in your calves.
No.
So now I'm going to assess your dorsalis pedis pulses. Posterior tibialis. Capillary refill. Now we're going to move on. So now we're going to go through some range of motion with your hips. What I want you to do is I want you to lift your leg all the way up. Good. And now I'll move both of them. Okay. Now I want you to lift it up and move it out to the side and down. Then back up and in. Any pain or stiffness with that?
Mm-mm.
Okay. So now we're going to test your knee range of motion. What I want you to do, before we move on to your knee, I have one more thing with your hip. I want you to lift your leg, and bend at the knee. So lift it up like this. And I want you to move it in and out. Good. Good. Now we're going to move on to your knee. So what I want you to do is to flex and extend at your knee. Good. You can go ahead and leave that up. Well, now what I want you to do is to move your lower leg in and out. Good. Any pain with these movements?
No.
So now, with your feet, I want you to push, flex them, or extend them, and flex them back in. Good. Now I want you to move your heel in and out. Excuse me. I'm going to do some range of motion, some strength testing. What I want you to do is to push down against my hand. Good. And push up. Good. Now the other. Push down and up. Good. Now I want you to push out against my hands. And push in. Good. Now we move on to your knee. I want you to try to push against me. Push down against me. Good. And don't let me pull out. Now push against me. Good. And don't let me pull you out. Good. So now push against my hands. and pull back. Good. What I'm going to have you do now is we're going to assess your Achilles reflex, and then I'm going to have you stand. So what I want you to do is to bend at your knee and place your heel on your leg. Good, and just relax your foot. Good. Now the other one. Good. I'm going to have you stand. I'm just going to begin by assessing your posture. Step that way just a little. Your posture, your muscle mass and symmetry of your muscle mass. Okay. Now I want you to just go ahead and walk normally for me. Okay. Now I want you to place one heel in front of the other. Any problems with your coordination or balance?
No.
So now what I want you to do is just to stand, close your eyes, and I'm going to assess for any abnormal swaying. Good. Alright, you can go ahead and sit back down, and we'll finish off your assessment. A couple of things we're going to do, we're going to assess neurological functioning now. I'm going to assess some sensation. What I want you to do is I want you to close your eyes and let me know if you feel a sharp or dull sensation on your upper and lower extremities.
Okay. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp.
Now keep your eyes closed and let me know when you feel a cotton wisp on your arm.
Uh-huh. Uh-huh. Yes. Yes.
Now on your legs.
Yes. 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 Yes.
A couple things we're going to do to test your cerebellar functioning. I want you to let me know. Close your eyes. I'm going to place two objects in your hands and let me know what objects they are.
A paper clip. A coin.
Okay, good. Now keep your eyes closed. And I want you to let me know if you feel your finger moving up or down.
Up. Down. Up. Down. Down. Up. Up. Down.
Good. I'm going to place this tuning fork on your fingers and let me know what type of sensation you feel.
Vibration. 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 Vibration.
So now I want you to focus on my finger and touch your finger to your finger to my finger and then back to your nose. Good. Now I want you to place your hands straight out and now bring them back in. Good. I don't see any tremors. I just want you to rest them on your legs. Good. Now, to assess your coordination, I want you to just pat your leg and turn it. Good. Now we're going to move to your reflexes. I'm first going to assess your brachial reflex. Tricuspid. Your tricep. Good. Your brachioradialis. Your patellar. And your plantar. Just want you to relax your leg, your foot. Mr. Mayers. I think that's everything. Let me know if you have any questions, and you can go ahead and get dressed.
Thank you.